Hi, Fred Page. I am performing my abdominal examination. I have started with laying my patient on the spine position, and I have a pillow under the head. We have emptied our bladder. My name is Fred Page. I want to be conducting an abdominal examination of you, and I want to ask if you please will raise your shirt. Okay, thank you. And I'm going to start by inspection. I'm just going to start by inspecting your belly. I'm expecting for any spontaneous movements or any pulsations. And then next, I'm going to start with going to my auscultation. I'm going to start by auscultating all four quadrants. I start with the right upper quadrant, move over to the left upper quadrant, and go down to the left lower quadrant, and move over to the right lower quadrant. And then I'm going to go up to do my aortic artery. I'm going to listen to it with the diaphragm first. And then I'm going to switch it over to listen to it with the bell. And then I'm going to move over to the left renal artery. Listen to it with the bell. And then I'm going to flip it over and listen to it with the diaphragm. Then move down to the left iliac artery. Listen to it with the diaphragm. And then flip it over to the bell. Listen to it with the bell. And then I'm going to move down to while I'm here, I'm going to touch your inner thigh, okay? And I'm going to listen to the left femoral artery with the bell first. And then I flip it over and listen to it with the diaphragm. Then I move over here, listen to it with the diaphragm, with the right femoral artery. And then switch it over, listen to it with the bell. Then I'll move up to the right iliac artery, start listening to it with the bell. Then flip it over, listen to it with the diaphragm. And then I'll move up to the right renal artery, listen to it with the diaphragm. And then I flip it over and listen to it with the bell. Okay. And next I'm going to do my percussion of all four quadrants. So I'm going to take my right hand and start with the left lower quadrant and move up to the left upper quadrant. Move over to the right upper quadrant and then move over to the right lower quadrant. I have lightly percussed all four quadrants, and then I'm going to percuss the liver next. I'm going to start, of course, with the livers on the right side. I'm going to start low at the midclavicular line, around the umbilicus. I'm going to work my way up, right hand. Okay. That is percussion of the spleen to where the sound turns tympanic to dull sounds. And then next I'm going to percuss the spleen. I'm going to start with the spleen is on the left side. So I'm going to percuss the spleen at the 10th intercostal space and to where I'm going to go upward. So about the 10th. So I'm going to start here. And move work my way there to actually percussing the spleen. So I actually went across and actually here the spleen is at the 10th intercostal space. So therefore I would actually, as I went across, actually I can also to work my way up. Okay. After doing the percussion of the spleen, I'm going to palpate the abdomen. I'm going to start with light palpation first. To where I'm going to, just so you know, I'm going to lightly press on your belly, okay? And I'm going to do that in all four. So this is the right lower quadrant. Move up to the right upper quadrant, and then go over to the left upper quadrant, and then go to the left lower quadrant. That's the light palpation. And then next I'm going to do my deep palpation. I'm going to let you know I'm going to press down a little harder this time, okay? And I'm actually doing my deep palpation. I'm going to press down and upward. That's the left upper quadrant. And then I'm moving up to the, this is the right upper quadrant. Excuse me, that was incorrect. This is the right upper quadrant, pressing down upward. And this is the right upper quadrant, pressing down upward. And moving over to the left upper quadrant, deep palpation, upward. And same thing here in left lower quadrant. Okay. Deep palpation in all four quadrants. And then next I'm going to do my CVA and rebound tenderness. So basically I'm going to press in, going to basically press in on the abdomen and release. Basically this test will actually, for a test for appendicitis or whatnot, actually the patient will tell me if there was any tenderness actually felt when I actually pressed in and pressed and released suddenly, and the patient did not respond or tell me anything far as when I pressed and did the rebound tenderness test. Lastly, I'm going to the aortic pulsation. I'm going to appear the aortic artery. I'm going to place my hands on both sides. Press on your belly. Okay. There, I'm actually measuring the the pressing in where the aortic artery is, and that's pretty much concludes my examination of my abdomen. Thank you.